everyone, today we are going to discuss a drug called bicalutamide known by its brand name, Casodex. Remember, the information in this video is for educational purposes only and should not be considered medical advice. Always consult a healthcare professional for personal medical concerns or treatment. Your health and safety are paramount, and professional guidance is essential for accurate diagnosis and care. Here's an overview of bicalutamide, which is available under brand names such as Casodex and Bicalutamide in Ireland. This summary highlights the drug's pharmacological properties and key clinical information. Below, you'll find 15 important facts about bicalutamide. 1. Definition and drug class. Bicalutamide, known by the brand name Casodex, is an oral non-steroidal anti-androgen used primarily in the treatment of prostate cancer. It belongs to the class of drugs known as anti-androgens, which block the action of male hormones called androgens, particularly testosterone, by binding to androgen receptors. This drug is commonly prescribed as part of androgen deprivation therapy. 2. Available pharmaceutical forms. In Ireland, bicalutamide is available in tablet form, typically as Casodex 50 mg. Other formulations include Bicalutamide and Casodex, both of which are also 50 mg tablets. Bicalutamide is administered orally and is not available in injectable or other non-oral forms. It is generally well absorbed in this form. 3. Therapeutic indications. Bicalutamide is primarily indicated for the treatment of advanced prostate cancer. It is usually administered in combination with a luteinizing hormone-releasing hormone, LHRH, agonist, such as leuprorelin or goserelin, as part of combination therapy. In some cases, it is used as a monotherapy for patients who cannot tolerate other forms of prostate cancer treatment. 4. Off-label uses. Off-label uses of bicalutamide are less common but can include treating hirsutism, excessive hair growth, in women, particularly in those with polycystic ovary syndrome, PCOS. It is also sometimes used in transgender women as part of feminizing hormone therapy due to its anti-androgenic effects. However, these off-label uses require careful medical supervision. 5. Mechanism of action. Bicalutamide works by inhibiting the binding of testosterone and dihydrotestosterone, DHT, to androgen receptors in prostate tissue. This prevents androgens from stimulating prostate cancer cells, effectively slowing or stopping tumor growth. By acting as a competitive antagonist at the receptor level, bicalutamide disrupts cellular signaling, limiting the proliferation of cancer cells. 6. Administration and dosing. The standard recommended dose of bicalutamide is 50 mg taken once daily, typically in combination with an LHRH agonist. It is generally taken at the same time each day, with or without food, and should be swallowed whole with water. Treatment duration depends on the progression of the disease and is usually long-term. 7. Pharmacokinetics profile. Bicalutamide is well absorbed after oral administration, with a bioavailability of nearly 100%. It has a long half-life of approximately 5 to 6 days, allowing for once-daily dosing. Bicalutamide undergoes extensive hepatic metabolism, primarily through oxidation and glucuronidation, and is excreted mainly via the urine and bile. Peak plasma concentrations are reached in about 31 to 39 hours. 8. Side effects and adverse reactions. Common side effects include hot flashes, gynecomastia, enlarged breast tissue, and gastrointestinal disturbances such as nausea and diarrhea. Serious adverse effects, although rare, can include liver toxicity and interstitial lung disease. Patients should be informed to contact their healthcare provider if they experience symptoms such as jaundice, persistent cough, or breathing difficulties. 9. Drug interactions and special warnings. Bicalutamide should be used cautiously with other medications that affect liver enzymes, as it is metabolized primarily in the liver. It may interact with warfarin, leading to an increased risk of bleeding. Caution is advised when used with other drugs affecting liver function or metabolism, such as rifampicin. Liver function should be monitored regularly during therapy. 10. Comparison with other anti-androgens. Compared to other anti-androgens like flutamide and nilutamide, bicalutamide has a better side effect profile, with lower incidences of diarrhea and liver toxicity. Flutamide requires more frequent dosing, usually 3 times daily, while nilutamide can cause more severe respiratory issues. Bicalutamide's once-daily dosing and long half-life give it an advantage in terms of convenience and patient compliance. 11. Contraindications. Bicalutamide is contraindicated in patients with severe hepatic impairment and those with hypersensitivity to any component of the drug. It is also contraindicated in women, particularly those who are or may become pregnant, as it can cause harm to the fetus. It is not a sulfur drug, so it is safe for patients with sulfur allergies. 12. Use in special populations. Bicalutamide is not recommended for pediatric patients, as its safety and efficacy in this group have not been established. In geriatric patients, no dose adjustments are typically necessary unless there is significant liver impairment. In patients with renal impairment, no dose adjustments are usually required, but liver function should be closely monitored in patients with hepatic impairment. 13. Prescription and specialist use in Ireland. In Ireland, bicalutamide requires a prescription and is typically prescribed by specialists, such as oncologists and urologists. It is not a medication that would commonly be prescribed by general practitioners, GPs, due to its specific indication for prostate cancer treatment. It is classified as a specialist drug. 14. Patient counseling information. Patients should be advised to take bicalutamide once daily, preferably at the same time each day. It can be taken with or without food and should be swallowed whole with water. Common side effects such as hot flashes and breast tenderness are often transient. However, patients should be informed to seek medical attention if they develop symptoms of liver dysfunction, such as yellowing of the skin or eyes. 15. Cost and insurance coverage in Ireland. The cost of bicalutamide in Ireland for a 30-day supply of 50 mg tablets typically ranges from €70 to €100, depending on the brand. Generic versions, such as Bicalutamide, are usually less expensive. Bicalutamide is covered by the Irish Health Service Executive, HSE, for patients with prostate cancer under the medical card and long-term illness schemes, but prior authorization may be required in some cases. So in conclusion, these are key facts that provide an overview of bicalutamide's pharmacology and clinical use, offering essential information for healthcare professionals and patients alike. If you found this video helpful, please give it a thumbs up and don't forget to subscribe for more content like this. Your support helps the channel grow and allows me to keep bringing you valuable information. Thanks for watching, and see you in the next video.